Hi, Professor Randolph. My name is Vera Clark, and I am going to be performing assessments on my patient, Cole. Done the best that I could to set up the camera so you can visually see me do the assessment and see the patient as well. I apologize for the light in the background. It's the best we can do right now. So for the first part of the assessment, I'm going to assess the patient's eyes. So I'm going to take a look at the patient's eyelids. I see that they are symmetrical. There's no drooping. Eyelashes and eyebrows are symmetrical. The hair is evenly dispersed on the eyebrows and evenly dispersed on the eyelids. I don't see any scaling or lesions on the eyebrows or the eyelids. I don't see any inflammation or redness of the eyelids as well. I'm going to now assess the sclera. Everything looks clear, white. No signs of inflammation. No lesions, no redness, no broken blood vessels. Looks like the irises are blue, almost the bluish gray. Both of them are of the same color. They are round and symmetrical. I'm going to look at the cornea. They are clear, round. There is no bumps or lesions that can be seen. We're going to take a look now at the conjunctiva. So Cole, I'm going to ask you to look up. I'm going to pull your eyelids down and I'm just going to observe your conjunctiva. Conjunctiva are a nice pink, no drainage, no signs of inflammation. No discharge. Everything looks normal there. I'm going to do the global tonus assessment. So Cole, you're going to feel me touch the outside of your eyeballs with your eyes closed. Okay, I'm going to just touch firmly. Okay. Do you have any pain or discomfort when I do this?
No.
Any tenderness?
No.
Okay, her eyeballs are firm. Upon examination, I don't see that they're sunken or protruding in any way. We're going to assess her lacrimal glands. So we're going to feel right up here. Let me see if you can see that. Right up here we have our lacrimal glands. Do you feel any tenderness or swelling here?
No.
Okay. How about here?
No.
Any tenderness or swelling? I don't see any excessive tearing. There's no signs of inflammation, redness, puffiness, or hot skin. Looks like her lacrimal glands are healthy and intact. Okay, now we're going to perform. Let me see if I can have you move just a little bit closer to the camera so she can see me perform your eye exam. So now we're going to perform PERLA, which is pupils are equal, round, reactive to light, and react to accommodation. So first, we're going to do the pupillary light reflex. Okay, so at first I'm going to check the left eye for reaction to light. The pupil constricts and then dilates when I move the light away. We're going to check the right pupil. It constricts and then dilates again when I move the light away. Okay, I'm going to have you cover your, oh wait, not yet. First, I'm going to shine a light into your left eye, and I'm going to watch the reaction of your right eye to make sure that the pupil dilates and constricts appropriately. Okay, you ready?
Yes.
Shining my light into the left eye, I do see that the right eye pupil does dilate appropriately and constrict appropriately upon the addition and removal of light. I'm going to do this for the right eye. Look at my nose. I'm going to assess the left eye when I add and remove light to the right eye. It looks like the left eye does react appropriately. The pupil does constrict upon light and does dilate upon the removal of the light. Next, we're going to do the accommodation, convergence and constriction of the pupils. So I'm going to hold my finger up, Cole, and I want you to look at my finger. Okay? And I want you to follow my finger as it comes towards your nose. I see the convergence of both eyeballs, and I see the constriction of both pupils when I do that. Looks like both pupils are equal. They are round, circular, and symmetrical. We're going to move now to assess her extraocular muscle function. I'm going to perform the Hirschberg, which is the corneal light reflex. I'm going to shine a light at the patient's eyes, and I should be able to see where the light is reflecting back on both eyeballs in the same place in each eye. So Cole, go ahead and look at my nose again. I'm going to shine my light. And I do see the presence of the sparkle or the reflection of my pen light in the same place on each eyeball. Now I'm going to test the 6 cardinal positions of gaze. I'm going to place my finger out in front of your body. Can you see this? I want to make sure that she sees that I'm doing this properly. Okay.
Yeah, it's enough.
So look at my finger. Okay, follow my gaze, or follow, your gaze should follow my finger. Up, okay. Out, good. Down, good. Follow my finger. Good. She was able to follow my finger consistently in both directions without any skipping. I am now going to have her cover her right eye with her hand. Go ahead and look at me. Actually, I'm going to put something over your eye. Hold on just a moment. Okay. I'm going to cover your eye, and then I'm going to have you just look directly at me. Ready?
Yes.
Okay. All right. Keep looking at me. Upon the removal of the card in front of her right eye, she was still staring at me directly. Upon the removal of the card from her left eye, she was still staring at me directly, which indicates that she does not have any, what would be known as a lazy eye. I did not see the eyeball spring back. Everything was looking good. So normally I would now check the vision using the Schellen chart, having the patient stand 20 feet away, using both eyes and then each eye individually. I would have her read the lowest line of the chart to assess her vision. But since we don't have access to a Snellen chart, I'm not able to do that assessment on her. Looks like the near vision portion of the central visual acuity test has been deferred. I'm going to now perform the peripheral vision, which is the confrontation test. So what I'm going to ask you to do is stare at my nose. Go ahead and hold your gaze. I'm going to move behind you, okay? Keep staring straight ahead. And I want you to tell me when you're able to see my finger wiggling.
Now.
Now? Okay, that's 90 degrees. All right. Remain looking forward and tell me when you're able to see my finger wiggling.
Now.
Now. 90 degrees on both sides. Looks like she passed the peripheral vision confrontation test. Okay, I'm now going to do an assessment of your ears. First, I'm going to visually inspect both ears. I'm going to look for assess the color, check for ulcerations, scars, pitting edema, or any swelling that might be on the ear. I'm going to check the external ear. Looks like both ears are symmetrical. Her ears are directly in line with the outer canthus. Placement is vertical. I'm going to assess each ear individually. I'm looking for any signs of inflammation, any drainage, any lesions, any scaling. It looks like this patient skin is intact. There's no drainage, no swelling, no ulcerations. Temperature feels normal. No scarring. Both ears present normal. I don't see any, I think I did mention I don't see any drainage or pus exuding from the ears. I am going to palpate, checking temperature, texture, turgor, and tenderness of each ear. I'm going to check the auricle of the right ear. Any pain or tenderness as I do this?
No.
I'm going to assess the tragus. Any pain or tenderness here?
No.
I'm going to assess the mastoid process of the right ear. Do you feel any pain or tenderness here?
No.
Okay. I'm now going to assess the left side. If you could kind of turn so she can see what I'm doing here. Okay. So I'm just going to assess the auricle, which is the outer ear. Any pain or tenderness as I move your ear?
No.
What about the tragus here? Pain,
No.
tenderness, or anything? Okay. And how about the mastoid process? Do you feel any tenderness
No.
behind the ear? Okay. I don't see that it's red, hot, or swollen on either side. Okay. I'm going to now test your hearing. So if you could face me, make sure that my instructor can see me. The first thing I'm going to do is I'm going to stand behind you on your left side. I want you to cover your right ear, and I want you to tell me what word I whisper, okay? Yeah, that would be good.
Cover my right ear.
Correct.
Okay.
Okay, ready?
Yes. Elephant.
Good. Now we're going to perform the test on the other ear. If you could please put your hand over your left ear. I'm going to stand here.
Ladybug.
Good. All right, we are deferring the Weber test, and we're also deferring the Rinne test. If I were to perform that test, I would take a tuning fork, strike it on the heel of my hand. I would place it on the top of her scalp, and I would ask her which ear she heard the sound in. She should hear it in both ears. I also would then strike the tuning fork again. I would place it in front of her ear. I would ask her when she stopped hearing it ring. I would repeat and then place it on her mastoid process and ask her again when she stops hearing it. And her air conduction should be greater than her bone conduction. Okay, we're going to move on to an otoscope examination. I do not have an otoscope, but I'm going to grab a tool to perform this assessment to pretend that I have an otoscope. Okay, this is my otoscope. It's an ice cream scooper. So the first thing I'm going to do is correctly position the client's head. Looks like your head is in the correct position. For adults, you gently lift the ear up and out for examination in the ear. For children, you would pull down. I would hold the otoscope vertically using my pinky against the patient's cheek, and I would lift the ear up and back and gently, shallowly at first, peer into the patient's ear. I should be able to see the tympanic membrane, which, if healthy, would appear intact, clear, shiny, gray, and slightly pearlescent. I would be assessing for any lesions, drainage, inflammation, or foreign objects in the ear. I'm going to go ahead and repeat this on the other side. Cole, if you can go ahead and face the camera so she can see that I am placing my pinky on the patient's cheek, gently inserting the otoscope into the patient's ear after lifting up and back. I am looking for the tympanic membrane, looking for any lesions, foreign bodies, drainage, discharge. For the left ear, the cone of light is going to be at approximately 7 and 8 o'clock. And for the right ear, I should mention that the cone of light should be at between 4 and 5 o'clock. Patient does not have any drainage, lesions, swelling, or foreign bodies in either ear. There is no impacted cerumen, no discharge. Her ears present healthy. Next, I'm going to inspect my patient's nose. First, I'm going to do a visual assessment. It appears the patient's nose deviates slightly to the left. She's indicated to me in her history that she has had a broken nose as a child, which probably is why her nose is deviating slightly to the left. Looks like her nares are symmetrical. The outside septum of the nares does appear to be slightly deviated to the left as well, which is probably as a result of her injury as a child. I'm now going to take the otoscope. I am going to look inside of the patient's nose. So I'm going to have you tilt your head back. I'm going to gently look inside of your left nostril. I'm looking for any deviations in the septum, any perforations. I do see some slight redness, which is normal. I'm going to go ahead and check your other nostril. Again, looking for a deviated septum, any perforations, any discharge, redness. Looks like everything is healthy and normal. I am now going to palpate the patient's nose. Looks like the temperature is normal, texture is normal. I'm going to do the bilateral patency test. So Cole, I want you to place your left hand over your left nostril and close it and take a deep breath through your nose. Good. Patient is patent on the right side. Go ahead and repeat that with your left nostril. Okay. Patient is patent in the left nostril. However, there does seem to be a little bit of congestion, but she is able to complete a breath in. Now I'm going to do an assessment where I palpate the frontal sinuses and the maxillary sinuses. So the first thing I'm going to do is you're going to feel my fingers upon your forehead. I'm going to assess your frontal sinuses, okay? So what you're going to do is you're going to feel, okay, you're going to feel my finger here. All right. Any pain?
No.
Tenderness?
No.
Okay. Now you're going to feel me do your maxillary sinuses. Pain?
No.
Tenderness?
No.
Any pain?
No.
Tenderness?
No. There's no room.
Normal? Good. Okay. We are deferring the olfactory nerve test. If we were to complete that, I would have you smell something and identify the smell that you smell. We're going to move on to the inspection and palpation of the mouth. I'm going to go get a pair of gloves. Okay, Cole, you're going to feel me examine your mouth. Get my gloves on here. I'm going to lift both of your lips. I'm going to assess for any lesions, cracking, discoloration. Make sure that everything looks normal, okay? Go and tilt your head back slightly. These gloves are a little big.
Yeah.
Okay, ready? Gonna lift your lip. No cracking, no lesions. Appears to be a light pink in color. Gonna check your bottom lip here. Light pink in color, no lesions, no cracking. She does have what looks to be 3 scars from labial piercings in the past. I am going to assess her gingiva. Let me see your gingiva are intact. I don't see any receding gingiva, no bleeding, no swollen gingiva. Okay, now I'm going to use my tongue depressor and I'm going to check your teeth. Looks like she's missing a molar on the upper left. Teeth are otherwise in good condition. She does have some fillings that are located in her bottom right molars, as well as her bottom left molars. Okay, I'm now going to check your buccal mucosa. So if you could open your mouth again, going to just assess basically the mucosa inside of your cheeks. I don't see any lesions. Nice pink color. Ah, it looks like you do have one little lesion back there. Did you bite the side of your cheek?
Probably.
Yeah, it looks like you have a little bit of a lesion right back there. I'm going to check her palate. So if you could open your mouth again, stick out your tongue, and her palate is hard, firm. No evidence of a torus palatinus or palatinus. I'm now going to assess her hypoglossal motor function. What I need you to do right now is look at me, stick out your tongue straight. Her tongue does exude in a midline fashion. Go ahead and do it one more time.
And just like stick it out like.
Yep, just stick it out. Yep, I don't see any tremor. Size appears to be normal. Move your tongue, stick it back out again, and move it to the left. Move it to the right. Okay, now I want you to do that again, but I want you to do it to where I'm going to push a little bit with the tongue depressor. You're going to push back, okay? So let's do the life. Well, wait a minute. Stick out your tongue. Okay, go left. Hard as you can. Good. And right. Hard as you can. Good.
I was trying to reach it.
Okay. I'm now going to assess her cranial nerve 10. I want you to open your mouth. Say ah.
Ah.
Uvula rises appropriately. We are deferring the gag reflex and the taste.
Thank you.
Okay, I'm now going to assess the patient's tonsils. If you can open your mouth. Tonsils appear to be at a 1+. Say ah.
Ah.
No signs of exudate.
Give me 1 second.
Sorry, the little dog got out. Okay. Okay, Cole, I'm going to do an assessment of your chest and your back as well as your lungs. If you could remove your shirt for me, please.
Making sure you can't see too much of the camera.
Make sure you're covered up. Great. Thank you. Okay, let me make sure that she can see me well. First thing I'm going to do is I'm going to inspect the skin, looking at color, looking for any ulcerations, scars, pitting, edema, or swelling, which I don't see. Okay, we're checking the anterior chest now. All right, first thing I'm going to do is I'm going to assess the ratio of your chest width to depth. So your chest should be 2 hands wide. Go ahead and raise your arms up for me. And 1 hand deep. And the ratio is intact. Next I'm going to do is I'm going to assess you for any signs of respiratory stress. So I'm going to see if you're flaring your nostrils. Nope. Showing any signs of having a difficult breathing? Are you having trouble speaking?
No.
Do you feel like you're having a hard time breathing?
No.
Her pallor is normal. There is no evidence of being cyanotic. Her accessory muscles are not being used to breathe. Her respirations, I'm going to monitor those for just a moment. Respirations are normal. I'm now going to palpate the anterior chest wall. And I'm going to assess for any nodules. Do you feel any pain or tenderness?
No.
Pain or tenderness here?
No.
Pain or tenderness?
No.
Okay. Thank you. Okay. I'm going to do a tactile test, checking the vibrations. Can you say 99
99.
again?
99. Red balloons.
Say it again.
99. 99. 99. 99.
Good. Nice dull vibration when she says 99. All right, now I'm going to have the patient take a deep breath so I can examine the symmetry of her chest as it rises when she takes a deep breath. Chest expands symmetrically. Okay, we're going to move on to percussion. I'm going to percuss the anterior chest in 10 to 12 places. I'm going to start here. Okay. Let me know if you feel any pain or tenderness.
No. Actually, did. No. 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 No.
Okay, that's about as much